Welcome everyone. I'm Monica Tarrant, Chief Innovation Officer with Give Them 10. Joining me today are Dr. Julie Levy, Fran Marino Endowed Distinguished Professor of Shelter Medicine Education at the University of Florida Veterinary College. We have Marnie Russ, founder of the National Kitten College. We have Tabitha Kucera, owner of Chirrups and Chatter Cat and Dog Behavior Consulting. And last but not least, we have from Maddie's Fund, Charlotte Otero, Community Strategy Manager and the expert behind Maddie's Pet Forum. We are here to answer questions you asked during our March 4th Camp Maddie Kitten Edition webinar. We're going to try to get to as many questions as we possibly can in this 2-hour session, and we are going to get to some new ones that you might have today. We've already provided some answers and links and additional resources you can find on Maddie's Pet Forum. You can find links to each of these discussion threads in that chat area too. Let's get started with your questions. We've got a lot of them for Dr. Julie Levy, who's going to kick us off. She spoke to us about medical protocols tailored for kitten care in shelters and rescues. And we're going to do these questions 2 at a time. So we're going to throw the first 2 to Dr. Julie Levy. Are you ready, Doc?
I am.
Okay, question 1. What is the right age for vaccination of shelter kittens? What if they have URI? That's only one question. And the second question is, we are having our vet give FERCP, but we're interested in doing this ourselves. But we're not educated on the dosage, how to give these vaccines, where to get them. Can you help with that?
Yes, I can help with both of those. We have road tested standards of care for vaccination in shelters, which are different than those for private practices or even sometimes different for kittens that are in foster homes and low risk of exposure to infectious diseases. So you may encounter when trying to apply these shelter protocols with private practitioners that they are not familiar with them. And so you can point them to the resources where this is all written down. So for example, there's the Association of Shelter Veterinarians Standards of Care document that outlines the vaccination schedule and type for kittens. But to summarize, we would start vaccinating kittens at 4 weeks of age, which is 4 weeks earlier than private practitioners are familiar with. And we are going to vaccinate them every 2 weeks, as long as they are in that high-risk situation. Now, we hope they're not going to stay in a shelter in a high-risk situation for very long and need to get a lot of different vaccinations. But if they are trapped in a shelter, then we vaccinate them every 2 weeks, all the way up to 20 weeks. If they move from the shelter to a foster home, and there aren't any other kittens in the foster home, now that becomes much more like a plain pet home, and we would move towards a vaccination schedule more like you would get from your veterinarian. And so we can usually still start them at 4 weeks, but maybe stretch it to 6. And instead of every 2 weeks, we can stretch it out to every 3 weeks. And the most important thing, of course, is to always be thinking about that cat superhighway, removing barriers to adoption, getting them through our shelter system or through our foster system, because even though they are safe, there are other kittens in your community that are not safe. We need to open up space to save them as well. And then the final point on regular shelter vaccination protocols is we use a live virus vaccine, a modified live vaccine. Both inactivated and modified live will work, but modified live works faster, and time is of essence in protecting kittens from these infectious diseases, particularly feline panleukopenia, which is the most important thing we're trying to prevent. The other thing about how vaccine, this leads kind of into the second question about, can you do your own vaccines to be more efficient, save time, save money, save those precious veterinary visits for the things you really need them for, rather than the things you can do yourself. But how vaccines are purchased, shipped, stored, prepared, and administered all impact the efficacy of the vaccine. So, if you buy them at the Tractor Supply store, you don't really know if they've been properly stored the whole time, or if it's an off-brand. There's all kinds of ways it could go wrong. So we really want to make sure that we have a protocol and that all of our people are adhering to how to administer those vaccines. So that's the standard protocol. Question 2 is about how can we start doing this ourselves to save money and time. You definitely can. You want to start with a relationship with a veterinarian who's going to write the protocol that they then train your team on. And it's very important if you're working with a veterinarian that's giving that level of trust that you adhere to their protocol. And if private practitioners need help designing them, that's where your shelter medicine programs can share the protocols that we have. But they're also available on ASPCA Pro and in that ASV guideline. And it's a very simple thing to do to give a subcutaneous injection. We can teach anybody to do that, so don't worry about that. But the other question you're going to have is, where do you get these vaccines at an affordable rate and that you know are good? And that's where I would recommend joining Shelters United, which is a group purchasing. It's a shelter group purchasing arrangement where you join this group as a nonprofit or municipal shelter or rescue, and that together gives you a lot more buying power than by being a small group buying a few vaccines. You can get better prices, but also they have a whole new program that I highly recommend everybody on this call attend, which is called the Veterinary of Record program. A veterinarian of record is someone who doesn't work for you full time, but they agree to oversee the care of animals. So they might visit just once a week or once a month, depending on how it's doing. And the rest of the time, you're following guidelines that they've written for you. And with that trusting relationship, you can then use their license to purchase medical supplies. So there is a 1-hour veterinarian of record course. After you take that, they will help match you to a veterinarian who has also agreed to do this. So highly recommended to start getting your medical supplies from Shelters United if you don't have your own veterinarian.
Thank you, Dr. Levy. Okay, next up, we've got a couple of questions for Marnie Russ of National Kitten College. And Marnie spoke to us about Kitten College small program, huge impact. And our first question for Marnie comes from Nancy, and she asks, does Kitten College support small rescues as well as shelters? And your second question is, how do you get fosters to want to give back their bottle babies at 3 to 4 weeks? Most of our bottle baby fosters just refuse to let those kittens go. They want to keep them tightly until they're 8 weeks of old.
Okay, well, thank you for your question, Nancy, and thank you to everybody who's shown up today to ask these important questions. With Kitten College, we sort of go everywhere for everyone. If you save kittens, we want to help. So I will say we work with people that are like home-based foster programs all the way up to super high volume, high functioning shelters. I feel like the program itself has facets of it that will work for almost anyone. And what we do is we work with you to figure out what those are. So it's about learning what the program is. Every single shelter, even if your demographics look the same, are going to be different. You're going to have different people that you support, different volunteers, different fosters. So what we do is we work to collaboratively all over the country to make sure that we all are a voice for one another. So I would say I would recommend anybody who runs kittens to at least check us out and see if there's something that will work for them. And my goal for the organization has always been to get to those that have zero resources. So that's something that we're working on. We literally are very new still, but I really want to get to those rescues that have no resources for kittens whatsoever, except for euthanasia. So even if we do things like triaging and finding a place to transfer them to, all of those services are going to look very different at a large urban shelter, highly resourced shelter. So the answer to that is yes, we work for all of them. I'd love to give you ways, but it's so different for each organization. Everything is so specific. And it's also very much a give and take, meaning, we will give you all of our resources, but we also learn from what you do. And we learn from the hacks that you people have come up with to make your lives easier. And then we share them as a group. So with that question, and then also the bottle babies. So that is something that is actually probably my number one question. And when we first started the program at the Animal Welfare League of Arlington, we set it out so that we really just let fosters determine their own destiny. So if they didn't want to give them back, well, then that's fine. We really want them to be in control of their experience, mostly because we want them to keep doing it. But what we found is over time, kitten fosters, we talked a lot about the importance of the socializations of these kittens. So by getting them into multiple fosters in that very critical 3 to 6 weeks of age, they become far more social. And whilst being socialized well is amazing, the best part of that is they don't get scared and they don't get sick. So, we don't want to compromise their immune system through stress. And if they're able to experience different things and not get stressed, then that's an overall health benefit for them. So what we found is that people had friends in the program that did ages above them. So we would have, let's say, Monica, Tabitha, and I were all fosters, and I did the bottle babies, and then Monica liked them when they were just weaned and starting to get active and watching all their first things, and then Tabitha loved them when they were older. Then I would start, and because I knew Monica and Tabitha, they could just take over. So it became something where we didn't really have them sitting in the same foster home for the whole time, because the fosters became very aware of the impact of that socialization, and also were comfortable handing them off to their friends. So, but what I would say is, if you do have some, let them know. Let them do it, but let them know how important that socialization is to their health as well as their adoptability. Because really, we're saving them to put them out into the community, and we want to make sure we put out the best possible cats.
Thanks, Marnie. Okay, up next, we've got Tabitha Cusera, owner of Chirrups and Chatter Cat and Dog Behavior Consulting and Training. And Tabitha spoke to us about positive beginnings, socializing kittens for a lifetime of success. And Tabitha has a couple fascinating questions up first. Number one, Tabitha, how can pheromones and classical music be used to create a feline-friendly environment? And number two, talk to me about transporting cats in carriers, please. Fear Free recommends covering carriers with a towel to reduce stress. Do you recommend that or something else?
Awesome questions. And to segue from Marnie's beautiful answer, I do think socialization has a huge misunderstanding in a lot of animal welfare, and we are not aware of the significance and severity of having to address that. So as she mentioned, a really simple way to provide that appropriate socialization during that key socialization period is switching up fosters. And I think when we explain to people the whys of things versus being like, this is behavior nerd Tabitha, but versus being like, hey, this is what we do, which can come off a little rough. I think when we work with each other and explain the whys and address concerns, like they may say, but I feel I'm going to listen to them and address their concerns and questions. But Marnie did such a wonderful job. So from environmental standpoint, that's a really great question because scent is huge for cats. Cats actually communicate via scent, and they use these chemical and olfactory signals to essentially feel safe in their environment. So pheromones can be helpful. There's a lot of pheromones out there, so that's where it could get a bit challenging. I am a fan of Feel Away, but even with Feel Away, there's some newer products that are still not out yet, so I can't speak about them, but I'm very excited about the newer products that are coming out. I know that's like a little bit, but I do think Feel Away definitely doesn't hurt, and you can buy it in bulk at a very affordable price as a nonprofit. But there are a lot of other ways you can maintain those familiar scents, which is really huge, which I know a lot of us have understood that we're not going to clean their linens every 5 seconds. Obviously, if there's excrement or something on it, we're going to clean them, but we want to do our best to keep some scent continuity with those kittens or cats of any age. So doing that can be helpful. Also, minimizing really strong smells. So I always joke when I lecture, like, I wear deodorant for my lovely humans, but I don't wear hairspray. I don't wear perfume. All of that is so aversive to a cat or dog, especially a kitten. Their respiratory tracts from a medical standpoint are so sensitive. So I think being aware, or if you smoke, I understand it's challenging, but you're going to smoke outside and then wash your hands. You're always washing your hands between kittens anyways, with like an unscented soap, right? Because sometimes I think we're looking out for each other. I worked with a lot of colleagues who would smoke and then spray themselves with Bath and Body Works, and they were coming from a really good place, but whoa, um, holy smells. So if it's aversive to me, it's definitely aversive and can cause respiratory issues. So I think just being aware of like, hey, let's use pheromones, let's clean, but there are products like Rescue that still smell, even though they say they don't, but they are less aversive and corrosive for your beautiful hands, and also for the kitten's respiratory tract, but kill the things because we have to clean and disinfect things. So I think just being aware of that scent continuity can be really helpful. And then also classical music can be really helpful because, again, the goal is to create a clean, calm, and warm environment. We know this makes a difference for us. This makes a huge difference for kittens. So I am a fan of like white noise or classical music to not necessarily drown out sound because they can still hear it. But it's similar to if I go to a spa, right? Usually there's classical music playing. There are scents that relax me. There's a lot of little things because sometimes people are like, the feel away doesn't work. And I was like, whoa, whoa, whoa. There is no secret magical thing. I'd be in Hawaii right now. I would have trademarked that. There's multiple things that we have to do. Think of your comfortable environment, right? With kittens, we can create safe, clean, olfactory, comfortable environments. We can play classical music if you have an area where there are dogs, and we're going to do the best we can. There are soundproof drapes that you could buy off Amazon for pretty affordable that goes over a door. And whoa, does that make a difference? Like there's a lot of options that are really affordable that I think we can kind of think outside the box to kind of drown out some of that sound. So those are a few things. Great question. I know it was a long answer. And then as far as transporting cats, I definitely agree of all ages that covering them with a towel can be helpful. Where that comes from, because again, some people are like, what? I like to explain the whys. If you are a human or animal and you are feeling fight, flight, fidget, or freeze, so any fear or stress, everything is more intense. That person in a horror movie who's in the closet and the person's coming to get them and someone coughs and they urinate on themselves, that person's not being dramatic, right? That person is in fight or flight. So every little stimuli is it's a lot more intense. So for example, if I'm a cat who might have some fear or stress, which traveling can sometimes be for sure, I'm going to cover that carrier 3 ways and give them an option to look out, but I'm going to minimize that visual stimuli. I'm also going to carry the carrier like this because cats are beautiful gifts. And I don't know why handles are on them. I wish we didn't have them to set human learners up for success. Cats don't like roller coaster rides. They like this. And also, unfortunately, I've seen cats get loose in specific environments, and this is beneficial for multiple reasons. So yeah, I would definitely, and also if you're doing like spay neuter, where you're transporting a lot of cats at the same time, consider location. I'm going to put the cats that are exhibiting higher fear body language up top. Every cat gets a cover. Sheets are cheap. No reason for us not to do that. But I'm going to be strategic in even the way I kind of set those cats up. So.
Excellent answer. That I'm learning from everybody as we go. So thank you, Tabitha. Next up, I've got a couple of questions from my presentation, which was navigating the kitten quandary in community cat programs. And I picked a doozy of a topic to start with because we may as well just get right into it. I had several questions on the spaying of pregnant cats, particularly community cats. And I would absolutely invite the other panelists to chime in on this if you've got strong feelings, because this is a pretty controversial and heated and emotional subject sometimes. So some of the questions I got were, how do we promote the spaying of pregnant cats? And is spay abort recommended to keep up with the cat populations, particularly the community cat populations? So we all get this question a lot, and it's very loaded, as you can imagine. And I have worked in communities where we did not do spay abort unless it was like end stage pregnancy and the kittens were really viable at the time of spay. And I have worked in communities where I walked in the door and said, we are spaying everything right now. And it really, the difference came down to me was, what stage of life saving are you at in your community? And are these kittens that are going to be born, are they going to displace currently alive kittens if you allow mama to have them? And then the other item that I want to make sure I cover is it humane to allow that queen to have her kittens, particularly if she is a community cat, particularly if she is not socialized, and if that means that she is now going to spend 6 to 8 weeks in a crate or a cage, or best case, someone's bathroom. Is that humane to do to her? So I have no moral issues spaying pregnant cats, with the caveat that no one wants to do this. None of your vets enjoy this. This is not what anyone wants to spend their day doing. Is it a necessary evil in some communities? Yeah, I believe that it is. The cutoff for me has always been, are these kittens viable at the time of spay? Meaning that, could they survive on their own outside of the uterus right now? That's tougher to do a spay abort on those, because the kittens actually need to be euthanized at that stage. But again, is it necessary? I've worked in communities where it is, because we had a 90% euthanasia rate of cats. In that case, we're spaying everything. So very loaded question. I don't know that you're going to be able to promote the spaying of pregnant cats, but you could, of course, make an argument that, hey, there are live kittens and cats being euthanized right now for lack of space or lack of resources. And our resources are better, better going to cats who are currently alive, or better going to more spay and neuter. You can certainly make an argument that it's an ethical thing to do from time to time. And is it recommended to keep up with cat populations? If you are really struggling to keep up with those cat populations, then yes, I would not lose sleep at night over it. So does anyone else want to add to that? Because I know it's a huge topic.
I will add, totally agree, and probably I'm even more on the, unless they're in labor, we spay them, especially in our community cat program, and especially with feral cats. We see some folks who are taking pregnant feral cats and confining them in a crate for them to have their babies and then raise them in a state of fear for a few weeks. And then if for some reason you end up with a feral cat in a litter in a crate, there was a question that came up in the forum questions is, when should you separate them? And they were doing it at 4 weeks. And that seems kind of like right about to me, because you're getting that terrified mom back where she belongs. She is not transmitting that fear to her kittens, and you're still in that socialization window where you can handle the kittens a lot and get them friendly to people. But confining a mom cat that is terrified of people for 4 weeks, who's trying to protect her babies and care for them, is really quite an unkind thing to do. It'd be better to spay her and let her go back and get fat and have a happy life. There are not very many places in the country that are not overburdened with kittens. In the wintertime, you might need a few more kittens to meet the demand for homes. But in kitten season, if you tie up a foster home for 8+ weeks with a pregnant cat that is going to have kittens, then that is a lot of missed opportunity for life saving to turn that foster home over more during that time. And even if your group is saving all of the kittens that come into your group, it is very likely that your community is not safe for cats, that the shelter, other rescue groups, whatever, may not be keeping up with the total. So part of the cat superhighway theme is to, grow outside of our organizations and collaborate and look at how we can make our entire community safe. And there aren't very many communities that are safe for cats in kitten season. And then finally, there is new information that even with those late term spay aborts, that you don't actually have to inject euthanasia solution into the fetuses. We take the uterus out, clamp it, and so the kittens are under anesthesia at that time. So they are asleep, and then their hearts stop after a while, but it can take a long time, like 30 minutes to an hour. And so just put it aside, don't disturb it, don't open it, because that is the stimulus for consciousness to develop. So if you just put quietly aside, that's probably the best thing. And we do like to reduce the use of euthanasia solution that goes into trash, because that wildlife can get into it sometimes and have secondary toxicosis. And I'll echo what Monica says too, is nobody likes doing this, and it's hard on surgeons during kitten season to do multiple ones in a day. But if those same surgeons are working on the other side with the shelter that's getting pan-luke and overcrowding or euthanizing cats that are already here, it becomes easier to be kind of intellectual about it, even if it's not that easy to not be emotional about it.
So to wrap that up, and thank you, Dr. Levy. I think if you are looking for our permission to spay abort, you've got it. You have all of our permission and support. That you should not lose sleep about that, and please don't beat yourself up if that is something that you think is best. And a lot of us do think that is best. So
Yeah, and I agree as well. And I love that you mentioned the mother cat, because something that I unfortunately see commonly, and I'm sure it's non-malicious, but no one considers the emotional, physical, social needs of this mother cat. And it is very inhumane, honestly, because I'm aware of what behaviorally is going on in that feral cat's mind. And it's, to me, that is what really hurt. Like, that's where my heart is breaking. And I think a lot of people aren't aware of that. And also being aware that mothers who have chronic stress, which most community cats do, that chronic stress is on the fetus. Those kittens, even if you have an advanced behavior person like me and which most of us don't, those kittens are starting with inadequate nutrition, chronic stress. So it's challenging for everyone, but we also have to consider it's not as simple as this female mother comes in, they're stressed for a while, and then they go out and the kittens are happy. I wish it was, but it's just not. So we kind of have to consider all of those factors. But again, thank you so much for bringing that up, Monica.
yeah, no, I'm so glad that you echo the same thing, because as the resident community cat advocate, that is always top of my mind of like, boy, I cannot watch mama suffer like this for 8 weeks. It's not right.
If I can also say something, Monica. So what I talk about in my presentations is we talk a lot about what it is for mama cats later in the season. So we talk about these kittens that, until we have the luxury of needing kittens, we need to look at this very seriously. But beyond that, kittens that have had 1 to 2 litters by October, those kittens that are going to be born are severely compromised because the resources aren't there with the mother. So they're, we're saving them to have them, suffer essentially. That's definitely a risk we take, especially with the late term, late season kittens.
Okay, thank you, Marnie. Fortunately, my second question is much easier and much more fun. So my second question, and I get this one a lot, is how long can we keep community cats before it's too long to return them back to their home? So like if I'm keeping them because they've got a broken leg, or if I'm keeping them because they are weaning kittens, how long can I keep them before I can no longer return them to their original location outside? I get this all the time, and this is fun for me because when I was a young cat rescuer, I came to Dr. Kate Hurley and Dr. Julie Levy and posed this question to them, and said, can we keep them like a month? Can we keep them a couple months? How long can we keep them? And something that Dr. Hurley said sticks in my mind to this day. And she said, Monica, when you go on vacation, do you forget where you live when you come home? And I said, no, of course not. And the same is true with cats. My rough timeline is now about 3 months, but I think that's actually very conservative. I think we could push it longer than 3 months. I have personally returned innumerable cats to their outdoor home 3 months or later, and I open the trap and they know exactly where they are. This has been proven to me a couple times because I opened the trap facing the wrong way, or I put them in the wrong side of the park and they looked at me like, you idiot, and went back past me the other way. They knew exactly where they were. Their familial bonds that they have with the family units, their cats that live in these colonies with them, they don't forget those after a month or two. Those cats don't forget them. They may smell a little funky, to the resident cats, but they don't forget those bonds. They do not forget where they are. There's some interesting research out there that I've seen lately about actually the great long-term memory that cats have, particularly when it's linked to survival, like food and safety. So that home, we can hope that it is really firmly embedded in their survival instinct. So my cutoff has always been about 3 months, but I will happily push that longer if given the occasion. And so when I first started, it was our neonatal program would get these community cat mamas, and then they would wean their kittens, and then they would have to get absorbed into like the working cat program. No, 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 no. Put them back home where you found them from when they are weaned and spayed and vaccinated and ready to go back home. No relocating them to your working cat program or finding some other outcome for them. Put them back where you found them from, assuming that that is a safe and responsible thing to do. Okay, we're back to you, Dr. Levy. Are you ready?
I'm ready. I actually saw a Q&A in the question box. I had forgotten to answer one aspect of the vaccination question, is that what do you do if the cats have URI or some other illness? And our recommendation would be stick with that protocol, vaccinate sick, injured, healthy, everybody with that protocol. You will not hurt them. They may have a diminished response, but very likely they'll have at least some response, and that gives the kitten at least some protection. So delaying vaccination because of a medical condition or another reason actually puts cats more at risk. And so just keep it simple, stick to the calendar.
Yeah. My rule for that was always, unless cat is actively dying, cat is getting vaccinated.
Yeah.
Yeah. Okay, your question, Dr. Levy, this is a long one and it's got several questions in one, so I'm just going to give this to you. For the shelter I am at, all animals are spayed and neutered before they can go home. That is the law. When we do spay and neuters for cats and kittens, they have to be at least 2 months and 2 pounds. Is this something that is accurate and correct? And then we will also pull kittens from mom sometimes at 4 weeks, depending on the care from mom, if she's feral, and letting us handle them, and if they're in shelter versus foster. Is that something that's also recommended, to pull those kittens at 4 weeks? And then the last question on this big one question is, our rule at the shelter has been that any kittens under 3 months are socialized in foster homes before being placed up for adoption. If they're not socialized by 3 months, they're being TNR'd. How do you feel about that? So 2 months, 2 pounds, pulling kittens at 4 weeks, and then 3 months socialization window.
Yeah, those are really great questions. Real world, everybody who does a lot of this work is going to run into these, and I like the thought process that she's going through and posing that question. I basically agree with most of it. So in general, two months, 2 pounds is kind of the standard baseline for spay neuter, because that's the time that, they're 8 weeks old, they're ready to be adopted, very easy surgery, they're probably weaned and in good condition at that time. So I would stick with that as the baseline. If they are not healthy at that time, I would wait and fatten them up first before I spay and neuter them. And on the other side, if you're a very crowded, busy shelter and you need to get animals through fast, and you've got fat and fluffy 6-weekers that are 1.5 pounds, a lot of the shelter vets will spay them as well. So I am comfortable doing any of those ages, kind of centered around 8 weeks, plus or minus a couple weeks, depending on the condition of the cat and your needs. But I would not be holding cats till 3 or 4 months of age just as a protocol to get them through vaccines or whatever. Like, let's get them again through that pipeline and open up space for the next kitties that need to come in. What was part 2?
Part 2,
Yeah.
2 months and 2 pounds, and then we will also pull kittens from mom at 4 weeks.
Yes, and so that one is the kind of the case I talked about, where they have a feral mama that they have confined, and now the kittens are kind of eating on their own at 4 weeks. And so is that a good time to split up the family? And I think yes. I do think, like, if for some reason you either misstepped or got stuck with a mama cat, maybe she was injured or something, you took her in, she had her babies, and so now you have them, that we do need to do everything that Tabitha is talking about mitigating their stress, and then keep that time as short as possible. She is better at raising her babies than we are, and she makes better nutrition than we do, and she gives them comfort. But Tabitha also pointed out, she is giving them stress signals all the time. She feels people are a danger. She's in charge of protecting her babies, and so she is going to convey to her kittens that people are dangerous, and that's not the message we want them to be absorbing during their critical socialization. So splitting them up at 4 weeks, I think, is a good option. And then the final question, I
The
don't know.
rule at the shelter is that kittens under 3 months have to go to foster, be socialized, and if they don't cut it by 3 months of age, out to TNR they go. How do you feel about this?
So 2 thoughts about that. One is, if you are in an area of the world that needs kittens year round, take in kittens and socialize them. However, if you are like your community is not handling all the friendly kittens already, like make that your top priority for foster homes and other care. Socialize them using the techniques that Tabitha talked about. Not, you don't want to flood them, but really humane techniques to bring them around. That is an age, though, where some cats are like trying to be feral and they've really been set up to be feral. And so not all of them will socialize, or especially they might socialize to you in that family and be perfectly happy. And then you try to take them to an event or adopt them out and they're under the bed again because they don't extrapolate that socialization to other people. So if you find that it's not working and you've got pressure to bring in other kittens that need life saving, I do think that moving them towards back into the field is an option. What I would say is that it gives me a little bit of anxiety to returning kittens after you've had them for months into an environment that they haven't grown up in. So maybe they were born into that environment at babies, but it's different than what Monica talked about with the adult cat that you've had for 3 months and you put it back and it knows where to go. This kitten didn't learn where to go. And there may not be the food supply that there was 4 months ago that the adult cats knew about. And so for them, if there's a caregiver that like this is the farm it came from and it can go back there, that it's going to get care, then I would say yes, return it there. If not, I think these are candidates to move into a barn cat relocation program because of the age and the risk that kittens have in the wild.
All right, thank you, Doc. Charlotte Otero from Maddie's Fund is helping us with some questions from the Q&A box. Charlotte, what's come up in there?
We've got some great discussion happening in the Q&A box. I've got one for Tabitha here. Donna asks, are there any recommendations how to adjust the 1-2-3 technique when administering ear wash as opposed to oral meds?
So some of you may not be familiar with my 1-2-3 medication technique. So at my social medias, at Chirps and Chatter on Facebook and Instagram and Behavior Vet Tech on TikTok, I have more videos than you'd ever want to see about kind, compassionate, feline-friendly medication techniques. So the 1-2-3 is one of those, and that is to administer oral medications. So that is kind of a loaded question, but a few things I would recommend just right off the bat is to utilize a considered approach. So I'm going to approach the cat. Here's my cat. Instead of approaching like this, I would always approach from the side. I allow the cat to remain in their chosen position. So I'm a veterinary technician and that's boarded in behavior. So I have experience in vet med, but also with behavior. And I'll be honest, I was taught to like flip them and do a bunch of weird stuff and put them in an uncomfortable position to start. And then we're like, why do cats hate handling? So the biggest thing is, hey, let me allow this cat to remain how they want to, which is in most cases, I cut nails, I medicate with the cat standing up, because most cats versus this whole wrapping them in a towel, flipping them, blah. So I think a good starting point would be doing it on an elevated surface that kitten likes. Most cats like to be elevated, utilizing a side approach, being calm, of course, taking a deep breath ahead of time, using something that cat enjoys. This could be play, this could be scent enrichment, this could be food. I can go on and on, right? And then essentially what you're going to do is you could use the toy or the treat to lure their head up and put the drop in. Or if you have to hold their head, even my hold technique is this isn't happening. This is happening. So I'm very gentle, because the scruff, that's a whole separate thing, but that causes escalation in fear and stress. It causes the animal to feel stuck. Similar to if I was getting my blood drawn and 2 arm straps, I'm going to go from green to red and bite you pretty quickly, because you took literally all my sense of control, which is what we know now that scruffing does, even though a lot of us, including me, were taught that. Thankfully, we're progressing. So those are just a few things right off the bat. Allow the cat to remain where they want, find things that the cat enjoys, and even if they are too stressed to enjoy that product or toy during the actual administration, end on a positive note. It might be just throwing kibble against the wall, because that sound of kibble hitting the wall or the floor, that is really reinforcing for a prey predator animal, and then they might also get the treats, and they get to get away from you, which is also reinforcing. If you're a trigger, it's not personal. So that there's a lot we can do in that moment. But I know that that was a loaded question, so hopefully those tips help. But I have tons more on my social medias that you can find, like literally instructions, lots of videos of feline friendly blood draws and all that lovely stuff.
Okay, Marnie, let's go back to you and talk some more about kittens. We have a question from Rosalie, and she asks, how do you plan for those after-hour emergency vet care from senior fosters?
Thank you for the question, Rosalie. And it's one we get quite a lot, but that actually is a little beyond our scope. That would be your shelter, how your shelter decides that. But what I can tell you is that we do have a group on Facebook called Kitten College Community. So I can give you some ideas of what some of the people we work with do, but I would recommend joining that group and asking that question to everybody, because you will find somebody that is the same size of your organization or has some of the same specifications to help. But I can tell you that when I was at Arlington, what we did is they had a rotating phone amongst their directors, so that somebody could contact someone at the shelter at any time. It would go through a director, and they would say, we have an emergency, and they would most likely say, take it to this emergency vet. We have an account there. They're waiting for you. But they essentially just had somebody on duty all the time. The other ones that I've worked for are with animal control, so they're open 24/7. So that's something that people have. And a lot of the the home-based foster organizations that we help, they have a contact person that's available at any time. You can also create a relationship with the shelter, or I'm sorry, with the clinic that's willing to take any of your kittens, and make certain types of decisions. You can say, here are what we will and will not do, but that's really a relationship between you and the clinic and your community. So we don't when we go and talk, we don't ever talk about like shelter protocols, because everyone's going to have different ones, and we respect those. And we don't talk about your vet protocols, because your shelter vet is in charge of those. We can tell you what other people do in other places. But that's really a great way to exhibit how this community works together, because everybody has that problem. I mean, kittens, if they're going to crash, they're going to do it at 2 a.m, not 2 p.m. So we need to be able to support our fosters through that. So please consider joining the Kitten College community on Facebook, and you can ask questions like that and others about things that you're dealing with. We can line you up with organizations that are built like yours.
There's a comment from Dallas Pets Alive that they use telemedicine. And I think that's a really good option for after hours, or even, all the time, if you don't have your own organizational veterinarian, and you just make an arrangements with one of the telemedicine companies and give them your protocols, and then your fosters can call in and get advice. And I think that was really good advice also, of course, is to have a plan before the disaster, because they do occur at 2 a.m. and you have a stressed out foster person trying to get care for a sick kitten, is not the time to try and start working on it. So having an MOU with your local emergency clinic that sets out the scope, like you might have a limit on how much can be paid before they have to check in with you, or these are our overnight protocols, or a euthanasia decision-making tree for those neonates that are fading. And you definitely, we are unhappy to learn how many kittens are still dying in care versus being euthanized, based on the data that's coming out of Shelter Animals Count. So we know that kittens that are dying without euthanasia are suffering more. So we need to do better about recognizing when that is happening and making sure that we always have access to humane euthanasia 24 hours.
And another thing, I've been working with the shelter in Charlotte, Mecklenburg County, and their vet sent me an amazing guide that allows fosters to monitor what's going on and then click on what it is. It's something that I'm looking to develop and share with everyone if we see that that's a viable source. So please stay tuned to what we're doing, because we're really lining up with shelter medicine and making things as easy as possible for these programs that are trying to save kittens.
Marnie, your second question, you and Dr. Levy touched on this a little bit, but it goes a little further. This person is asking, do you have protocols as to how far you're going to go in terms of what medical issues you're willing to cover, willing to treat? And specifically, what do you do if you've got fosters who are upset, for example, that they cannot go to a veterinarian emergency clinic if they've got a fading kitten?
Yeah. Well, and I think that that's also a question I get all the time, and that's going to be up to your shelter vet. But for me personally, and for advice I would give to people, is exactly what Dr. Levy said, is we need to realize that these kittens are often not meant to make it. There are reasons that they pass, and I talk about a vet in Montana that taught me when I first started this 20 years ago that kittens die in fours. And what that means is they'll die. You'll see them start passing at 4 days, 4 weeks, or 4 months. And it's an old wives' tale, but I really think that there's a lot to it. And it's kittens that aren't built to make it. We can see them live for a few days, but then if their bodies just aren't developed the right way, they will start to fade at 4 days. And then at 4 weeks, because, all of a sudden now they're moving a lot and we see heart conditions pop up. If they have an enlarged heart and all of a sudden they're running around and their heart can't take it, we see them pass. And the 4 month part of it was at that time, 20 years ago, that was when people would sterilize, and also so the anesthesia could create a problem. So I would say look at that, like look at, how did this kitten do up until this point? And we always would do supportive care, but with neonates, there's not a ton you can do. In our shelter, we got the incubators and the oxygen concentrators, and that's essentially what would happen with the kitten at an emergency vet. They would put them in an incubator to monitor, to maintain their body temperature and give them oxygen. So just be aware of what you're dealing with. This is a high mortality group, and some just absolutely are not meant to make it.
Charlotte, do you want to come back and throw us another question or two from the Q&A box?
Yeah, of course. So we have a question here from Adriana. She asks, sometimes we have issues with the socialization of ringworm kittens, especially those that have taken a long time to clear. They are sometimes fearful of people and not visible on the adoption floor. What is a good way to tackle this?
So there's so much you could do. Yay! So with ringworm, of course, we want to wear full PPE and do all of that. But honestly, I think we should be triaging behavior. I triage medicine like I triage behavior. And although all kittens should receive appropriate socialization, and there are very easy, practical ways we can start to implement that into our programs, let's say you're still learning about it, because we all start somewhere. I think we should be prioritizing kittens who have medical issues, because I'll be honest, in many of the cases I'm brought into, these kittens, their medical issues were treated, but people were doing the best with what they knew, and maybe feline friendly handling techniques weren't taught or understood, and their only interactions with humans were not positive. They didn't end positively, they didn't start positively. So I understand why now that they're feeling better, their behavior has severely regressed, or again, it never even really started off on a positive note to begin with. So I work with a lot of shelters where we prioritize, like, hey, kittens in our ISO, of course we do full PPE, we do target training and clicker training, and there's a lot of creative ways that take a few minutes that these cats can be enriched and socialized, because sometimes I think we don't realize that you're going in there to spend time with them, to treat them, feed them, all of that lovely stuff. So we could just utilize the same things we're doing with other kittens, except full PPE. And target training is something where you teach a kitten to touch a target, usually a nose target, to like a palm ball with like my pen, like a palm ball attached to a pen or wood dowel. And it's a very easy behavior that we could teach them, and then we could use it to move them without touching them. There's lots of other cool things that we can do. So the good news is there are a lot of things we could do. I think we just need to prioritize it, because I think in our brain sometimes we're just not thinking about it. And then after we're like, they're feeling so much better. Now we have to catch up. It's kind of like you can't catch up on sleep. I wish you could. I keep reading studies and you just can't. So I could just not sleep well for 2 weeks because I'm overworking. None of you can relate to that. And then be like, I can catch up. You can't. You can't catch up on sleep, and you can't catch up on socialization. So I'm super fun, but this is just the reality. So I think just making a point to prioritize those kittens and having, like, for example, we had a clicker trainer ISO person that specifically would be the person. That's the other thing, the same person or same two people who tended to be interested in behavior because we wanted to empower them as well, would be those people that would work with those kittens. So you could still do those socialization things in short periods of time. It's just we have to wear PPE.
The other thing I would add is there's no reason not to build up a foster program for ringworm kittens too. They don't have to be in a shelter the whole time. And so they can have all the benefits of fostering in a safe environment that doesn't contaminate the whole house.
Yeah. Okay, I want to take one from my my session's questions, and then Charlotte, I'll come back to you for another live one after that. This one is really important, and it is in regards to something Julie mentioned earlier about the cat superhighway. And of course, this is our foundation piece to all of these kitten conversations. And because the cat superhighway is telling you we've really got to ramp up our infrastructure and get these cats the correct solution for them as quickly as humanly possible and get them literally going down a speeding highway, not like poking along on a bicycle, right? We need them speeding down the highway. And so the question I got is, what are your specific recommendations for reducing obstacles to adoption? What should be required of adopters and what should not? So this is a big conversation too. And Maddie's team, if you can find and put in the chat link, I've got a whole course on this on the Maddie's University that anyone can take at any time, self-guided online course for free about cat adoptions and reducing barriers. So specific recommendations to reduce them. Number one, get rid of that 4-page application. It should be under 1 page or under, and get rid of all the intrusive, obnoxious questions in it that end in isms, what I call isms. And so these are questions that are closeted: racism, classism, bigotism, is that a word? Any of these isms that don't belong on there. And those questions we didn't put on there because we're being snarky. We put them on there out of good intent, and it has led us astray. Those questions look like, what do you do for a living? What is your income? Have you ever tell me about the last 700 animals you've ever had in your life and what became of them. Bring in everyone in your family. They need to meet the animal. These are all barriers to adoption. I think it should go without saying nowadays in 2025, but it doesn't necessarily. No home checks. Please stop it. No veterinarian checks. Please stop that. This is not about you're not going to give a cat to anybody who walks in the door, but anyone who walks in the door should minimally leave a more educated and responsible pet owner, whether they get a cat from you or not. And I want you all to keep in mind that if you deny someone a cat adoption, this is important, you are not stopping them from getting a cat. They will have a cat by the time they get home from a van in the Walmart parking lot or anywhere else, but the cat that they get is going to be intact, not vaccinated, not microchipped. It will come with no education. It will not come with your safety net of a shelter. So minimally, you have an opportunity to send home a spayed, neutered cat who is vaccinated, who is microchipped, who comes with your safety net, that you'll always take it back if something happens, who you're going to keep in touch with and say, hey, how's everything going with that adoption? You have an opportunity to make a bad situation into something good. And perfection is the enemy of good. Do not keep these cats in your facilities waiting for perfect to come along, because perfect is not coming along. My home is not perfect. Tabitha's is not perfect. Marnie's is not perfect. Dr. Levy's home is not perfect. None of us are perfect homes. But in the meantime that you're waiting for that perfect home, that cat is suffering in your facility. Even if it's the most beautiful facility in the world, it is bad for those cats. And any cat that I've ever met in my career would rather be in a not perfect but good home than to be in a perfect shelter. So please move with urgency with these cats. Consider them like your own cat. You would not want your own cat spending a single night in a shelter. Please give the same courtesy to your wards who you are waiting to adopt out, and eliminate those barriers. So that also looks like You're only open between, every Monday and Wednesday from, 2 to 3:30 p.m. when there's not a full moon. You need to be open when people are off work and on the weekends, nights, evenings, weekends. And again, this should be fun for people to come adopt. It really should be. This should be fun. You should turn them into a supporter, a volunteer, a foster, a donor. These people should be your fans when they leave. They shouldn't feel like I'm now going through an inquisition and there's some sort of test that I don't know how to pass. I shouldn't feel confused or on guard or like you are trying to catch me up on something. I should feel like when I walk in the door, you are here to help me take home a cat today. And that is my motto. When someone walks into one of my shelters, I assume you are leaving with a cat today unless you prove to me otherwise. Start with yes, come from a place of yes. And so just please eliminate all those barriers. I've got a sample cat adoption questionnaire. If you want one on that Maddie's link, this should be an open conversation, not a quiz. That's the advice I have for that. And unless we've got anyone else who wants to add to that, which I would suspect some of them do. Charlotte, let's come back to you and see what is live in the Q&A.
All right, we've got another one from Charity who asks, thoughts on single kittens being put with other kittens around the same age for socializing?
So I marked that one to answer live, and I also put a link in the chat to the Correct Shelter Medicine Guide to Raising Unweaned and Underage Kittens. And this is how I met Marnie, actually. Was I came across this discussion about like, when do you like mix litters of orphan kittens or add a kitten to a nursing litter or vice versa? And because of the risk of infectious disease, but also trying to balance how we know how much better mom can do. So I'm going to throw it to Marnie to describe her risk assessment in how she decides when to mix litters, because I thought it was brilliant.
Thank you, Dr. Levy. And what she's talking about are the guidelines that we did with UC Davis and University of Wisconsin. We can put those in the chat. But basically, we really look at why kittens, when kittens come in, we risk assess it. Where did these kittens come from? Do we know that maybe it came from an area where there was a lot of FIV, panleuk, ringworm? Is this something where it is high risk? Or did it come from, somebody's home cat that was never around anything that would have been at risk? And then we take that and decide, we really try and make it so that we get kittens with kittens, because that's how they learn to be cats. They can't learn it from us. We do know that there are obviously risks in integrating from other litters. So if it is something where you're like, this is a kitten that comes from a high risk area, this is something they can have, then we get them around, we send them to foster homes that have well vaccinated dogs. So much as, we don't really need to worry about a lot of zoonotic issues with these animals. Obviously, ringworm is an issue that is a risk we take anytime we take a kitten in. But if you don't have like aged and like sized kittens, then, do it with an animal, another type of animal that would be very good. I specifically had a little dog that was incredibly good with kittens. And so I would bring singletons home with him and they would chase him around and he would play with them. And then also when you bring that kitten back to the shelter, that kitten's good with dogs. It doesn't have negative experiences in that really important time frame to deal with. We really try and minimize it. So a lot of times it used to be 2 weeks. Now it's 7 to 10 days. Now it's sometimes one of the vets and places that we work with, if they don't break with anything in 48 hours, they would go. So I will ask Allison to put the quote or I can put the link to the guidelines that we did and to what Dr. Levy is talking about. She reached out right after we did that, and that was a whole panel of folks from University of Wisconsin and UC Davis, where we updated those guidelines. You really want to make kittens adoptable, and making them adoptable makes them, you have to really work within that age of socialization. So we really add that into our risk assessment.
The other piece that I thought was the mathematical piece of assessing how many other cats you are going to put at risk by mixing a litter. And that was like just clicked for me, that if you have one singleton kitten and there's a mom with 4 kittens, you're going to add her on, you're putting 4, possibly 5 cats at risk. If you have one other singleton kitten and you put the 2 singleton kittens together, now you're only putting 1 other cat at risk for transmission of a disease. And so that really helped me frame, we can't eliminate all risk, but we can reduce the level of harm that we would cause if we do have a problem.
Tabitha, you've got a couple questions that are related to this, about asking if fearful kittens should be separated from their very social siblings, or do they benefit from staying together, or when that same old mixing of when we're mixing shy and social, does pairing the shy one with a confident kitten, does that benefit? Do these rub off on one another?
So awesome questions. One thing I think is important to mention, I know, but these are great questions and I'm going to answer them. But sometimes I feel like I hear these questions and I think that that's what people think socialization is. So no matter what, these are tiny little factors that do play a big part, and that's why behavior is fun. Tiny little things mean big things. But let's say you have kittens, let's say they're all from the same mother and they're siblings, and one is fearful and the other, based on what behaviors you're observing, appear more confident and less fearful. Ideally, of course, keeping them together is best, like based on the minimal research we have, but also my experience, we want them to stay with their siblings, ideally, and their mother in a perfect world, as long as possible. Even if the kitten is fearful, but we have to address that kitten's fear, because it's not as simple. Yes, cats help learn cats to cat, but I can't just say, hey, his siblings are confident, he'll be great. I still have to do appropriate socialization. And if I have a cat that's experiencing fear and stress, I'm going to have to use classical counter conditioning and desensitization and behavior modification techniques to essentially address that cat's fear, because just having them with their confident siblings doesn't make it all better. But it definitely helps. And in a perfect world, ideally, they would stay with their siblings. And as far as taking, let's say you have a shy kitten that maybe is a singleton, and you have, as Marnie and Dr. Julie was mentioning, of course, we want to consider disease risk and all of that. But definitely them being that fearful kitten, being with confident kittens, even if it isn't their siblings, is a big thing that will help. So if those are things you can control, kittens being with other kittens is great, but we also have to make sure to address that kitten's underlying fear and stress. And just being with confident kittens, just like humans are humans, and I get that, but if you have a lot of anxiety and you're with someone like me, which I have anxiety, but I'm also very extroverted, have lots of coping mechanisms, your anxiety doesn't just get better. You feel like you might be supported and in a safe environment, which helps. So those definitely ideally stay with siblings, put shy cats with confident cats. But the big thing is there's no magic thing. We still have to address that cat's underlying fear and anxiety to help them thrive.
Tabitha, I've got one more question for you. It's about one of my favorite subjects in the world, barn cats. And it's because I have two questions about barn cats that I'm going to answer after you, but I want to hear your answer to this barn cat question first. And it is, can barn cats be taught to be friendly with people? And if so, what approach should be taken?
So I get this all the time. And I love that all these questions about behavior and socialization are coming up, because it's a struggle out there to find resources. And all of you are killing it out there with what you know and continuing to learn more by coming to events like this. So I'm a language nerd. And first I'd be like, okay, if we're defining barn cats, which I think when you're working with volunteers and staff, defining what these words are to you is very important, because I have a huge background in behavior. So my definitions for behavior terminology is probably more accurate, right? But also I can't assume what you think. And I know that causes a lot of tension sometimes when we do that. So if I was to define barn cats as a feral cat, yes, it is possible to socialize them, but it's generally not recommended. Successfully socializing a feral cat requires advanced behavior modification skills, which many of us don't have, a lot more time, and a very controlled, calm environment, which also, although some of us are doing our best, we don't have that either. And we also often have limited resources, so prioritizing other forms of care, such as providing safe outdoor spaces, proper shelter and food, is just a more practical and humane approach, realistically. And in the cases where I have socialized a feral cat, they've been situations where awesome people weren't aware of what a feral cat was, and they know me, and they reach out and they say, Tabitha, there's a cat in my wall. And I'm like, I got you. And the cat was there for a hot minute. So that was a very specific situation. And we help those cats become more comfortable. And also, I think it's important to define socialization. How someone mentioned that question about after 3 months, that cat's not socialized. I'll be honest, how are you defining socialization? In your organization, I highly recommend identifying what socialization is, which you can go back and check out my webinar. And also I have a lot of resources on my website, but define what socialization is. Because if socialization is you touching the cat while they eat, that is not socialization based on what I'm saying. Or if socialization is that cat being comfortable to approach one person with no other things happening, that is not socialization. So I think there's a huge misunderstanding of even what socialization is. And if you're one of these amazing fosters out here, this happens to me a lot where they're like, it's been 3 months and I feel like I'm failing, and we move them to another room. So we're basing socialization on some time limit, but not actual data or goals. So this poor fosters, I'm like, you're amazing. You don't have any criteria. You don't even know what to do. If we're saying they should be great in 2 weeks, that already tells me that we kind of have to back it up, because that's not realistic. Just like, I can't say I'm going to get over my anxiety in 2 months. We would never say that, right? But unfortunately, I hear that a lot with socialization. So I think a good starting point is to define what that is, understand what that is, write out goals, which I have all of these. Like, here's clear goals. And then if we don't see those goals, we have data, and there's plan A, B, C, versus what I usually see is, it's been 3 months, it's not working, go. And I understand we're limited with what we know to do, but the cool thing is there's lots we can do. So.
Thank you. Okay. 2 barn cat questions, then they are related. So the first one I got was, what do you do with cats who are trapped and their caregiver is moving, or there's no longer a feeder there? Do we relocate those cats in a barn cat program, or do I return them to home and hope that they will find a new feeder? And the second one, which is a different question but related, is, can you share why it's problematic and risky to move these cats? Why can't I just put them in a barn cat program? Is it hard on them? Does it not work? What's the issue? And so the first question, what would I do if I had a cat who was trapped and their caregiver said, I'm moving, that's it, there's no one left to take care of these cats? We've got great studies. There's a new recent one that even came out showing the number of Americans who actually feed free roaming cats. And it is way more than you probably think. It is over 1/3 of Americans are feeding community cats. And so if you are a community cat caregiver or a longtime trapper, you probably know this, right? These cats are going trick-or-treating from house to house to house and visiting all sorts of neighbors. I promise you that very few cats have actually only one caregiver. They know they have actually a quite large territory that they're on walkabout in every day, and they know it like the back of their little paw. Who's got snacks out, who's got the good snacks out, who puts snacks out later in the day when I'm hungry for an afternoon snack, they know. And so if this cat presented to me at an animal shelter and the caregiver said, I'm moving, I would say, there's a couple things we can do. First of all, talk to your neighbors, talk to your friends. I bet you that they're feeding too, or they'd be willing to. Talk to your neighbors, talk to your community. I bet that the cat will be fine there. If that person is like, I have not heard from any neighbors, I don't have any neighbors, woe is me. If the cat presented in good body condition and I've looked up the location where this cat came from and it looks like it's quite suitable to cats, and there are ample resources there, I would put the cat back. That to me is far less risky than relocating that cat. So why is relocating that cat risky? Why can't we just round up all these free roaming cats and put them in barn cat programs? Why is this bad? Barn cat programs are absolutely wonderful. They are an enormous life-saving tool at our disposal. But a working cat program is your absolute last resort for when a cat has no other outcome. So that is for cats who maybe they turn up at your shelter outside in the morning, someone abandoned it there overnight, and you have no idea where this cat came from. That is a good barn cat candidate. As well as some cats who just simply will not live indoors and can't be returned. But that relocation process is very time consuming. We're talking 4+ weeks. It is not always effective. So you can keep that cat confined in its new barn home for 4 weeks, 6 weeks, 8 weeks, and you can open that crate door one day and that cat is out of here and there's no rhyme or reason as to why. And that cat is now in an area where he or she has never been before in her life. She has no idea where snacks are, where predators might be living, where shelter is, who you are. All they know is that my whole family unit is gone. I have been teleported up and transplanted down on some bizarre new planet. And there's probably like horses or pigs or other things that I have no idea what those are, and they're terrifying. They've lost their entire family structure and friend structure, and there is no good that comes from this situation when that cat chooses to flee instead of stick around. Now, some cats absolutely will stay around. That's why we have barn cat programs, right? And they work, but they don't always work. And I think that this is another situation in which we have to consider, is this humane to do to that cat? You're minimally talking about an unsocialized cat who is locked up in a condo, best case like a tack room or something, but locked up for a month, getting separated from, again, all of their friends and family in a new location where they don't know absolutely anything. Can you imagine the fear that that unsocialized cat has? Is that humane to do? Or can we try putting that cat back where it came from and maybe we'll check up on it. We'll make sure, go back on a week and see if he's doing okay out there. That relocation process is always the absolute last resort. So that is why we don't just go round up everybody that's outside and get them a lovely little barn home. That's why it's the last resort. That's why I'm going to put back that cat who presents and says, my caregiver is moving. What do I do? You're always, always, always going to go back to your home if at all possible. That's what I've got. Charlotte, do you got another live question for us?
Yeah, we've got plenty. So I think both of these are a little related to your presentation earlier, Monica. So this one asks, is there any existing data about barrier-free adoptions and foster/volunteer retention? I see data provided regarding shelters and returns, but haven't seen anything about the relationship between open adoptions and in particular fosters raising bottle babies from 0 to 2 weeks on.
Boy, Marnie, I wonder if you would have anything about foster retention data. There's lots of data out there, of course, about barrier-free adoptions and things we don't have to worry about anymore. We know that, you know, the threat of gift adoptions is nowhere near as bad as we thought. We know that, you know, this black cat nonsense at Halloween, we know that this is a complete myth. We know that home checks and whatnot don't really do any good. There's lots of data to support that. I suspect we're kind of asking that my fosters maybe are giving me pushback when I try to reduce those barriers and threatening to leave the organization or something. I suspect that's what the nature of the question was. And if that's the case, I think you'll actually get a lot more fosters who are open and want to be progressive and save even more lives than you would if you maybe part ways with some folks who don't want to. But Marnie, what do you think as far as foster retention?
I agree with you 100%. Like you're always going to get a lot of pushback from things that are new. So a lot of it is in your messaging and how you market it. I always try and market things and trying to get people to see the side through the animal. And that takes some time, but everything evolves. And so just stay on message and continue to do what you're doing. And if you lose some fosters, I always tell fosters that, if we're not the right organization for you, there are others that are. Don't not foster, but maybe if you don't like our protocols, that doesn't mean that we're a bad organization or you're a bad foster. It just means it's not a good fit.
Yeah. This may also come as a surprise to everyone listening, but cat people don't like change.
Cats.
Charlotte, do you want to give us one more and then we'll come back to Dr. Levy?
Yeah, let's see. We've got another one about socialization. So what is the quickest way to socialize feral kittens without flooding? Our shelter has always relied heavily on flooding the feral kittens because it makes them quickly handleable, so we are able to care/medicate them easier.
it may feel like it makes them easier to handle. And this is where I think I keep getting into defining things, because I hear the word taming and tolerate a lot. That is, if my partner, if I tolerated him touching me, we're getting a divorce, right? So I use a lot of analogies to help us understand, because, or again, unfortunately on YouTube, if you were to search, like, I'll see a glove and a cat that's exhibiting multiple signs of fear and stress. It's just people aren't recognizing them, and they're eating, and people are like, this cat's socialized. I was like, oh my goodness, this is dark. We are essentially, this cat is giving us 20 signals that they are uncomfortable and saying, please stop. And because they're eating, we're like, they enjoy this. I eat when I'm scared and stressed a lot. So I think there is no magical quick fix. Again, I keep with behavior, that's with anything really. And with flooding, actually, it takes a lot more time, because what happens is they aren't actually socialized. What we're teaching them is, we're holding you, you're showing tons of signs of discomfort during your key socialization period. So then what we see, for example, something I commonly see is the person may say, Tabitha, I feel like they were doing great. And then we move, as Dr. Julie kind of briefly mentioned, then we move them to another room, or maybe back to the shelter or into a new home. And they've regressed so severely that they are way worse than when they even got to you to start with. So that tells me that most likely they were flooded, which meaning if you're afraid of something, you kind of expose yourself to that full force. Like if you're afraid of spiders, hopefully none of you are. If I put you in a closet full of spiders, not only are you still going to be afraid of spiders, but it might, like, most likely will escalate your fear and stress to the point where you leave that closet, you see a speck of dust, and you feel the same flight or fight response that you feel when you see a spider. So you've generalized that fear to not only spiders, but to other things, which makes sense because you were exposed to what you were afraid of full force. So flooding, although it may feel like it makes animals easier to handle, it doesn't. And I think there's a big miscommunication about identifying what body language we're seeing, because I think hissing and growling, those are at the tippy top of that ladder. There are 40 to 50 signals before that I'll be honest, as a vet tech, I wasn't taught a lot of those things. So it can be challenging, but we can learn them and identify them. And honestly, when we're going at the kitten's pace, so we're starting with some of those foundations, we're creating an environment that meets that cat's physical, social, and mental needs. We're creating a safe and structured program. Lots of shelters, thankfully, have a lot of structure due to staff, and I know a lot of awesome fosters are like, we interact with the kitten at this time, and predictability and structure are huge. Like, those are really good things to start with. And if we're going at the kitten's pace, even when I'm working with feral kittens, which I do not, again, that's more advanced, but I see changes very quickly because I am working with that kitten based on what they are showing me, and I'm not progressing until they're ready. So, I mean, I've socialized feral kittens in very short periods of time. But again, it makes sense because I'm going at my learner's pace and adapting my approach to that kitten. So it actually takes a lot less time, but it's a skill, right? Just like everything, we're all learning. Handling is a skill. Like what I was taught to what I do now, we are always getting better. Understanding kitten body language, I know way more than I did even 2 years ago, right? So I think the biggest things would be if you're recognizing that you're flooding, which amazing that you're recognizing that and you're doing the best with what you know. I think, hey, let's break down and maybe let's prioritize learning body language, and then also identifying those goals of socialization, which I would call kittens to approach you and others without fear, the kittens to seek attention. So they choose to approach you with fairly relaxed body language and literally lean into you. That is what I mean by solicit attention. I'm going to boost confidence, broaden life experiences, and then I want the kittens to associate potentially negative things like carriers and people with positive stuff. So I know that you're like, please, Tabitha, tell me just one quick thing to do. The quickest thing to do is create a safe environment, assess that kitten's body language, and adjust accordingly and go at their pace. And with that information, they learn a lot faster. And then when they go into a new home or with new people, they generalize positive stuff. So they don't live in a basement, which is a whole separate thing, which I'm sure Monica could go in. But a cat living in a basement, it doesn't need to be that way. They're most likely dealing with some pretty severe medical issues, including like a generalized anxiety. And although they're in a home, right, they're living in a basement, right?
I'm so glad that we have all this behavior knowledge and education that is coming at us now, because when I started in the game, the motto was, "He who hisses gets more snuggles." And what I'm hearing now is that is not correct.
But you know that, Monica, because you're amazing. And we should all do a panel where we share something we did 10 years ago.
Yeah, oh boy, yeah.
We would all be cringed, but that's good. We're always learning. None of us know everything.
Okay, Dr. Levy, question for you coming back around to the medical side of things. Do you have any studies or guidelines to share about the use of doxycycline or other antibiotics for URI versus famciclovir?
That's a really good question, and there's some new information on this. So in general, when we're talking about upper respiratory infections, we're going to start with doxycycline. I had quite a few questions about what's the best drug to start with. And the reason doxycycline is good, even in very young kittens, is it treats the bacterial infections that are most common. So Bordetella, Chlamydophila, and Mycoplasma. Now remember, antibiotics only work on bacteria, not on the viruses that are the other part of that group of infections that we can see causing URI, multiple organisms in the same cat. So the antiviral is famciclovir, and that works against herpes, which is a very common cause of upper respiratory signs in general, but also ocular signs. And a paper just came out of many hundreds of kittens, or at least over 100 kittens, in which they tested kittens that had URI with ocular conditions with doxycycline alone, famciclovir alone, or the two combined, and its clinical signs resolve faster with the two combined. So that's actually new information that's very helpful to know, because it was done on the target population of kittens with these signs. So I would personally start with doxycycline as a single agent, but if they are not getting better, or if they have severe ocular disease, I would add the famciclovir.
Okay, thanks, Doc. Marnie, I want to come back to you with two questions about fosters, because fostering seems to be a real challenge for a lot of us. So the first question related to fosters is do you recommend that our shelter or rescue staff is involved in fostering, or do you worry about burnout and it would be preferable to leave fostering up to non-staff residents of our community? And then the second question related to fostering is besides Facebook, what social media platforms or other communication do you use for your kitten fosters?
Okay, thank you so much. That's an excellent question. Both of those are. I'll address the social media one because we have always used Facebook, and now old people use Facebook, and it all changes. So I know that there are ever evolving means. A lot of groups that I work with will do Google Groups, so I know that that's an option that's often used. And they will have their on deck. I'm hoping to get some more information on onboarding and stuff. So look for that as we move forward, just so we can kind of find out what's working best for everybody. But right now, I would say the most effective is Facebook. And a lot of people are on Facebook simply for professional reasons. And so that has been what we have used. And then the first part of the question is allowing staff to get involved in the fostering. And I don't know that I've been to a rescue or shelter that doesn't have it. I think in an ideal situation, no. Like, we need to allow shelter staff to have a good work-life balance. But during kitten season, that's not always an option. So my advice would be, yeah, if you can make it so that fosters or that staff don't have to. I remember when I had first started the nursery at the shelter in Arlington, I, for myself, had to stop taking kittens because I was there 24/7. And then if I was home and had kittens to worry about, it wasn't a healthy situation for me. And I recognized that. Some people can't recognize that because the need of saving lives is so critical and it's so in your face. Support one another. and really work to build up your fosters so you can get them out to people that aren't saddled with animal care all day.
I would also add there are some HR issues with allowing your paid staff to take home animals after hours, and it's related to if cat care is within the duties that they have in their day job, that is considered overtime. So you have to be very careful, either match job tasks that are not related, like your office staff can take kittens home, or vice, shake it up. Or what we do sometimes is we let them foster for another organization. So transfer the kittens to another organization, and then they're fostering for them, not for your organization. But there are plenty of examples of the disgruntled ex-employee who then sues their former employer because they were doing animal care at night, even though they can't volunteer essentially to do the tasks that are part of their normal job description.
That's a really good point. Charlotte, I think you've got a couple more questions for Dr. Levy in the Q&A, don't we?
Yeah, we've got a few more testing and vaccine related questions for you. So Glenn is asking thoughts on combo testing cats and kittens as part of intake services. And then Tamara also wants to know about grouping cats in rooms in a shelter environment. Do they have to be fully vaccinated, especially if they were surrendered versus found?
Okay, so for the first one is intake combo testing. This goes back to a bigger policy decision about your organization about whether it is doing foster or routine combo testing or just FELV testing for all cats. So more and more shelters are starting to say if they are not group housed, we don't have to test them in the shelter, because you will not spread those viruses on your hands or your clothes if cats are in individual cages or if they're in foster homes. So it's expensive to test all cats and time consuming. So if it makes more sense for your shelter to give that up in whole or in part, and let people test after they adopt, that is something we talked about in the recording, and so you can listen to it more. We also have a session on Maddie's University that Monica and I did together about testing, in which case it was about shelters that do test, but we called it one and done for everyone, like to really simplify it. So if your shelter thinks that it makes sense for them to do FELV testing at a minimum or combo testing, intake procedure is a great time to do it. I would say, from 8 weeks on, you're going to be right most of the time. There are exceptions. Underage kittens are where it really gets to be fun. And when Monica was at Austin Pets Alive and they had their kitten nursery and we were doing FELV study, it's like, why are these kittens positive in the nursery and negative with us? And they're changing all the time, and only part of the litter is positive. We haven't really solved all the questions around what is happening with positive underage kittens, and why do some of them seem to become negative at a very early age before we think their immune system's really kicking in. Lots to learn about that. But once they're 8 weeks of age, most of the time, your single one and done test is going to be correct. And for us, it is just easier for us to test in our program because the rescue groups that take from our shelter want that. And rather than us trying to fight it all, it's just easy. It's easy for us. We got vet students to do all the work and we get cheap tests. So that's the decision we made about why we continue to test. But there's good reasons for not to, especially if your resources are scarce. And then there was, I can never remember 2 questions in a row. Charlotte, what was the second one?
Yeah, it was grouping cats together in a shelter environment.
Okay, yes.
Do they have to be fully vaccinated?
Okay, so first I'll break it into 2 parts. One is kittens. I just generally don't mix litters. Like that, it's a better overall policy to say don't mix litters unless you're making a strategic choice to put 2 singletons together or something and accept the risk. But when you start piling multiple litters into one group housing, that is when you're going to start to see infectious diseases like ringworm and panleuk really break out. And besides, they should be flying through your shelter system and really don't need to be group housed. For adults, though, group housing and free range rooms can be very nice for showcasing the cats, learning more about their behavior, giving them more space so they can interact, vertically, and indoor outdoor is great if you have runs like that, like dog runs for cats that enjoy other cats. And not all cats do enjoy other cats. So when we're making decisions about group housing, first figure out the behavior of the cat and try to keep small groups. high turnover in large groups is really disruptive and stressful for the whole group. But so we'll give Tabitha the acreage around behavioral issues with group housing, but I'll talk about the infectious ones. And do they have to all be fully vaccinated? With adult cats would mean 2 vaccines. And I would say no. If you have a strong protocol for intake, disease screening, good exam, make sure they're healthy, give them a FERCP and treat their parasites and test them for FELV. If you do all of that at intake, and they seem compatible with other cats, I would go ahead and right away put them in group housing if that's the flow of your shelter.
Okay, excellent. I've got one question circling back to community cats that is, I think, a really good one. And it says, what is the appropriate next step for a feral cat, free roaming community cat, with a chronic medical concern, such as it's previously blocked or it's got a terrible food allergy, and the cat will need lifetime monitoring and care if there's not a committed caregiver? What do we do with that cat? So this is a really good question. I get this one a lot. It's usually like, what do I do with this community cat who has a leg amputated or an eye enucleated, or it's got stomatitis? What do we do it? Do we just put it back out now? These are terrific cats for what I call special working cat adopters. These make great bodega cats, shop cats, warehouse cats. I've adopted 3-legged, full mouth extraction stomatitis cats that are now like liquor store cats, or any type of business where you can keep a little eye on them a little more. And they might even be indoor working cats now in places that have giant warehouses, or even very cushy like polo barns or dressage barns. They tend to have nicer accommodations for some of your special needs working cats. So these special needs cats are absolute candidates for what I call special working cat adopters. And as a pro tip for those of you who have working cat programs, you will get adopters who come in that stand out in your mind because these are amazing humans and they've got this like incredible setup for the cats and they are above and beyond wonderful adopters. Write them down and keep a spreadsheet of them, because you are going to circle back to those folks when you get one of these cats who needs lifelong monitoring and special conditions. Send those special adopters a really pathetic email with a photo of the cute cat and its rough, hard luck story, and you're reaching out to them because they're so special and they know that they would provide them the really loving home that it needs. 100% of the time, these folks will take these special needs cats. And then also make a note of like, hey, they're also looking to adopt ducks and pigs and chickens and whatnot, because you will also get those some point in your career and need to find those folks again. So those cats who have chronic medical conditions, they absolutely can still have an outdoor or free roaming kind of life. I would not euthanize them simply because they've got some sort of lifelong medical condition. You absolutely can find different accommodation for them that is humane and suitable to their socialization level, but can provide a little bit more for that ongoing monitoring.
Monica, Melinda has kind of a follow-up question that is related to that. Litter box averse cats, also gentle, timid, won't allow human contact, but does not lash out. Kitty's on a waiting list to go to a sanctuary, but she's wondering about a working cat. Okay, yeah. Can you explain your thoughts on that?
Yeah, sanctuary is almost a banned word in my theory. Cats who are litter box averse, and I'm sure Tabitha has got entire, books written about this. But if this is a cat, there's a lot of reasons why a cat might not be suitable to live indoors in a traditional pet home. Litter box aversion is one of the more common ones, but it also might be, do you ever have one of these cats who's just in trouble all the time and he's just biting everyone and he's just a constant, I call this too much cat. This cat needs a job to do, right? So there's a lot of reasons why these cats may not thrive indoors, and an outdoor or predominantly outdoor or hybrid type of home is absolutely what's best for these cats and is the most humane solution. So there's a wide variety of what those cats would look like that could be outdoor candidates that don't fall into that just completely unsocialized bucket. They don't need sanctuary placement. Absolutely not. These cats are super adoptable. In fact, there are a lot of working cat adopters who would like a friendly working cat. They don't all have to be completely unsocialized. There's a ton of people that are just looking for a pet cat, but that lives in the barn. And so again, they don't really care if hey, the cat is litter box first, because I'm not going to give him a litter box anyway. He's going to pee out in the barn or in the field, wherever he's going to go. So that is not a problem even if it's a friendly cat that now needs to live outdoors. So there is a huge possibility of potential homes for cats of all behavior spectrums and whatever their special need or challenge might be. I would be very leery of sending anything to a sanctuary, because I promise you that almost anything that comes through your door is in fact adoptable if you cast a wide enough net. Charlotte, do we have another live question?
Oh yeah, we're going to go back to some more enrichment things for you, Tabitha. So Amelia wants to know, what do you think about leash walking shelter cats within a designated shelter area as part of their individual socialization and enrichment while they wait to be adopted out?
I freaking love it. So that's just one, because as all of you amazing people know, I have the pleasure of consulting with hundreds of shelters. So I learn a lot, but I also get to interact and engage with lots of people that also teach me a lot. And enrichment can look a lot of different ways. And to be fair, it should have a variety of options. And outdoor time is a really great enrichment activity. So in my kitten socialization classes that I teach with shelters or virtually or in person, we teach harness training as part of that kitten socialization. And then we have a field trip, which also is great publicity. I want your shelter to have a positive community outlook. And also it makes cats look good because, hey, they can be trained. Let's break these stinking stereotypes about cats. So also you walking a cat outside may seem like, yes, you're meeting those cats' needs, they're being enriched, but also you can make a post and blow people's minds. It upsets me that it's so mind-blowing because it shouldn't be, but that tells us, and that's also going to help people realize how amazing cats are, because a lot of them don't. So yeah, I think harness walking is great. It's just we want to make sure that during that key socialization period, obviously we could just place it on, have them walk and play. As they get a little older, we have to teach them to wear that, but that's fairly easy to do if you have those training foundations. So it is important to recognize, like, because a lot of people are like, my cat just flops over. I'm like, that's learned helplessness. Let's unpack that. That means we just started with step 50. Like, you just gave me the keys to the car when I was 14 and you didn't tell me anything to do. It's not going to go well. That's the last goal, is me driving the car. So we want to harness train, but also some cats outside might be too much. So I might start with them in a catio and see how they do with the harness, right? I have 4 cats. One is, he likes to look out windows. One likes to walk in metro parks. One likes to walk in backyard. One likes to chill on catio. All great. So you have to kind of identify what they like, but also there's cat strollers, which a lot of shelters I work with are starting to use, because that's a way to have them enjoy outdoor time in a way that they might be more comfortable with. Or again, many people, understandably, from a human perspective, aren't comfortable walking cats because they've never done it. So strollers are also a really good way to help get volunteers more comfortable with a harness on, because safety, second, first, third, is also a really great way. Or making a catio. I mean, there's so many options, but that's an amazing enrichment thing. And what Monica was mentioning earlier about colonies, caregivers, I do have a resource on my website to teach a feral cat to love going into a trap. And it's super easy, and you don't need any behavior background, because some cats have to go to the vet a lot. And when it's a feral cat, we can train them without touching them to happily go into a trap on cue. And it's really easy. So and then if you have someone that's taking care of that cat, when you're like, hey, they're trained to go in their trap, that person is going to be a lot more like, great, awesome. This is easier for me. So I'm more likely to say yes, but also care for that kitty.
That's fantastic. I'm going to look for that. Thank you, Tabitha. Marnie, I want to come back to you. We've got a couple related questions about fomites and viruses and bacteria and other things that strike fear into the heart of neonatal caregivers. The first question is, do we worry about all of those unclean hands handling the teeny tiny little baby kittens? And then how do we alleviate concerns about taking these teeny tiny little neonates into public areas? Does the benefit of that outweigh the, cost of the potential illness?
Yeah, that's a good question. It's one we get quite a bit. And I would say it's very much similar to the when do you combine? You have to look at the cost versus the benefit. We know the benefit to getting these kittens out into super different exposures so we can get them to build up that immune system. And you can't build it up if you don't do it. If a kitten is compromised in any way, we would not take them to outings. And I will say a lot of the outings that we do at AWLA, we would take them in to see to a 911 call center. It's a high risk, it's a high stress environment for the workers. But what we want to do is take kittens in to organizations like that aren't going to have cat specific fomites. You're not going to take them to another shelter or another nursery and introduce them to other kittens their age. Like that's something that, we know that they have the possibility of picking up something there. It's less likely if you take them to a retirement home that they're going to get a zoonotic or a non-zoonotic disease. So it's really a cost versus cost analysis. When I have kids come over, if they have family pets, we'll have them wash their hands before they play with them. There are definitely things that you can do, but healthy kittens are much sturdier than we give them credit for. Unhealthy kittens are the ones that are really at risk. So if we know a kitten is starting to slide or not gaining weight, even if they have no acute symptoms, but their weight hasn't stabilized, then those are ones that we would probably not put them in those positions. But healthy kittens should handle it very easily. Just be careful with what locations you take them to.
That is good advice. Charlotte, we have another question for Marnie regarding foster recruitment, don't we?
Yeah, absolutely. So Marnie talked about this during the live session, but someone wants to know more. They really love the event ideas for foster recruitment and kitten adoption. Can you elaborate more on the drag queen kitten bingo and kitten yoga? They would love to host events like that in Hawaii.
Well, one thing that's really great about the Kitten College concept is that it's just a shtick. It's alliterative in that it talks about, the stages, but it's something that the community can look at and think, what is Kitten College? Whenever I go out wearing my logoed gear, which I do all the time, my friends hate it, but I just love the logo, and I think it's such a unique little thing to be like, well, what is Kitten College? Who doesn't want a PhD from Kitten College, So we do a lot of things where we let the community know what we're doing. And that's something that, everyone assumes the shelter knows, if there's a shelter in your community, they know you have animals. But do they know that you're doing things where, you have a Kitten College program? We have to let people know that neonates are the most euthanized animals in shelters. And yet they're also, when they are of age, they are the most adoptable animals in shelters. So it's very much a manageable problem. We just have to let people know about it. So we can do it in Arlington. We did the drag queen tiny kitten bingo, and it was something that might not work in some communities, but in our community, it was simply an Instagram event, meaning that, you're going to go and you're going to share on Instagram that you went to something called drag queen tiny kitten bingo, but essentially it was just drag queen bingo. And in the beginning, we had people walk through the entrance, and we had our foster kittens set up in cages. They weren't holding them, or we had bottle babies that were being fed by their fosters, but they were able to see them. And a lot of people have never seen a 2 or 3 week old kitten. So it did a lot for letting people know in the community what we were doing and what exactly we were saving. And if you hold up like a 3 week old chubby little fuzzball and say, this is what's most euthanized, people are inclined to act.
Thank you for that. I made the mistake of looking at the Q&A box, and now there's one in there that I like, oh, I can't let it go. There's a question from Aaron who asks, would no home checks include verifying if landlords allow cats? Here is my advice on that. Yes, that would include calling the landlord and making sure that they allow pets. Here's what my adoption application says. Are you allowed to have this pet where you live? Yes or no? Great. If you say yes, then we're done talking about it. I don't even know what kind of home you live in, whether you own or you rent it. It's none of my business. I like to treat all of my adopters like grown adults who come in and tell me the truth, unless they prove to me otherwise. And so I assume that that applicant has looked into it, has talked to their landlord, knows whether they can or cannot have that cat where they're taking it home to. I hear everybody like, oh no, but what if they don't? If they don't, they will get home and the landlord will say that cat's got to go. And then the cat comes back to me, no harm, no foul. It got a short stay out of the shelter. And we also can call that fostering. It is not a bad thing when cats get returned. We have to let that concept go. So also, again, remember the superhighway. These cats are flying at full speed down the road. You do not have time to pull over and start making phone calls to check up on your potential adopters. Assume that whoever came to the shelter that day is here to do something good and they want to help. Assume that they are good unless they prove to you otherwise. Treat them like an adult unless they prove to you otherwise. So no checking with the landlord. Are you allowed to have this cat? Yes, you are. Great. Moving on. Okay, I couldn't let it go. Dr. Levy, I want to come back to a question for you now. And this is a big one. Is influenza now a concern in shelters?
Yeah, for sure. Anybody who has been under a rock and hasn't noticed that we have a bird flu outbreak needs to catch up on the news. So we are now seeing H5N1, high path bird flu, especially the West and Midwestern states. The wild birds carry it, so we have no control over the source of it. Now it is mutated and it is very prevalent in poultry farms and more recently in dairy cattle. And once it got into dairy cattle, this amazing thing happened where all of the cats on the farms died. And that was the first sign that there was a problem. And these cows, who are not very sick themselves, were shedding tons of virus in the milk, and the dairy cats drink the milk, and they died within days, often with neurologic signs that look like rabies. So very dramatic presentation. And what we've learned since then is cats are pretty susceptible to bird flu. But the way a lot of cats get it is through eating raw poultry or dairy products. So right now, even if you are a fan of those products, now is not the time to feed them to cats. There's already been a number of deaths in indoor-only cats that are being fed these commercial raw products. And that includes freeze-dried poultry products. Probably safer at this time to feed beef and some other alternative proteins, but not the poultry and the dairy. Then where else can cats get exposed? Well, our TNR cats are a big concern, right? Because they're on farms and they're out at lakes and they're interacting with birds. So that's a higher risk population for encountering the virus out in the field. So what our recommendation would be if you have outdoor cats is to move them away, move feeding stations and attractants away from bodies of water, because that's where the waterfowl, which are the most sensitive, are going to be gathering. And then their feces has a lot of flu in it, and that's how the cats get it. If you have backyard poultry, now is not the time to be letting your backyard poultry and your outdoor cats mingle. So try and find barriers to keep them apart until this epidemic of bird flu is over. And then so what about TNR programs? We would recommend that our caregivers be on the lookout for cats that are sick, either with severe respiratory signs or showing neurological signs, blindness, staggering, abnormal behavior. And those cats should be brought for veterinary care, but you want to call your vet first and give them a heads up that you're concerned this cat may have bird flu, because they're not going to want you to parade into their waiting room with this cat that is spewing bird flu. And if you have to handle a cat that is suspicious or known to be infected, you have to wear full PPE. So you need eye protection because you can get it across your mucous membranes in your eyes, mask, cap, gown, the whole works, gloves when you're handling these animals. In some states, your fish and wildlife people will pick up dead cats that you find that you want to be tested. Your public health departments may be a place you can have cats tested if they're sick. The commercial labs will test cats. Some of the health departments and ag departments are so busy with poultry and cows and wildlife testing, they won't even test pet cats for us at this time. They're really super busy. And then the federal firings of vets who are working for USDA and others are making it even harder to address bird flu. I would also tell caregivers to feed cats in a way that does not attract other species to come. So we don't want to splatter extra food on the sidewalk when you're feeding cats, because then the raccoons and the birds are going to come too. So feed them elevated and just what they're going to eat at that one time. And then finally, as cats are coming into your shelter or into your TNR programs, we don't want to stop those programs, but we do need to ratchet up our safety. So you can add some questions about the source of the cat. Does this cat come from a farm? Do you know if there were cows or poultry on this farm? Have you seen them be sick or have neurological signs? Like just that quick screening will let you know that you can take those cats in, but put them in a separate area and deal with them at the end of the day. If you have a known positive cat, so far, most of the positive cats have died very quickly, but we're probably seeing the worst cases right now because it's new, and those are the ones that come to our attention. The ones that are exposed and infected and get better, nobody's bringing to the vets, right? So there are some cats that we know have been infected and have survived. So we would just want to give them good nursing care, but in the context of full PPE. And the good news is they probably won't shed it more than a couple of weeks, so it will come and go in a defined amount of time. Not so you don't have to hold them a really long time until they're safe to be around other cats. We do have a link. I think it's posted there. We try to keep it up to date with the latest findings. You can go on there and find the USDA map that shows all the mammals that have been confirmed by USDA and also the current recommendations. And check back frequently because we are updating them as we learn more. This is something new and frankly quite scary for us.
Yeah. Speaking of resources, we've only got about 5 minutes left, Tabitha, and I've got two kind of weighty questions for you that maybe you can provide some resources or direct folks to them. Two questions for you. One is about PTSD and anxiety in cats. If you have any resources, you can share about that. And then also FHS, feline hyperesthesia syndrome. Kind of underdiagnosed, tips for managing it. Do you have any resources or thoughts that you can quickly share on either the PTSD and anxiety or FHS in cats?
Yes. So quickly, while cats definitely can experience trauma and exhibit behaviors similar to what we see in humans with PTSD, there is no diagnosis for cats for PTSD. So that from a veterinarian behaviorist standpoint, that isn't a diagnosis or a term that we would use to describe severe fear and trauma. But so we would call it severe fear and trauma. And in those situations, it's, I sound like a broken record, but creating a safe and predictable environment, so positive human interactions, the 5 feline pillars are being met, which you can find lots of resources at catvets.com and lots of other places, which is providing a safe place, providing multiple and separated key resources. So food, water, vertical spaces, scratchers, opportunities for play and predatory behavior, consistent human interaction, positive and consistent, and then also an environment that respects their sense of smell, which is kind of what I've talked about a lot today. And then that also helps you to build trust. And then you want to ID and avoid, to the best of your ability, triggers. So for example, if you notice that your cat runs and hides when a stranger comes over and doesn't return to baseline, for example, doesn't come out from under bed and exhibit what their normal body language behavior is for a day, hey, we're going to create a safe space for you and give you some good stuff and put some classical music on. And hey, before the stranger comes over and the stranger's going to text and not knock and ring my doorbell, we're going to minimize, hey, just avoid that trigger altogether. And that makes a big difference because if they aren't having that opportunity to be away from their triggers, they can't recover. And then, of course, more advanced behavior modification to help change how they feel about their emotional states. And that could be along with anti-anxiolytics and behavior mod. And then as far as feline hyperesthesia syndrome, so hyperesthesia just is a term we use to mean increased sensitivity to touch. And we're learning a lot about it still. It's believed to be both a neurological and behavioral condition, but again, it's complex. So I think the biggest things are taking videos of your cat. So let's say maybe taking a video of you petting your cat. If you notice that your cat is running and chasing their tail or their skin is rippling, now that I say it, you'll see it, take videos of that. I'm a huge fan. Every vet visit that my clients do has videos. So that way your vet can see, which is really helpful. Not that your descriptions aren't great, but seeing is believing. And then we're going to rule out neurological issues. We're going to rule out pain or discomfort, because the amount of cats I see who develop hyperesthesia from severe unmanaged pain. I had a client whose cat's hips were broken for quite a long time, and it's probably the most severe hyperesthesia case I've ever seen. Because even once that pain is managed, they've been dealing with it for so long. So it's complex. We have to kind of address, and the veterinarian has to help rule out skin allergies and all that stuff. And then as far as treatment, it's all about plus or minus medications. In many cases, they are indicated. Usually there are seizure meds or gabapentin. But again, that's something you would talk to your vet about. Environmental enrichment and stress reduction are the biggest things. Behavior's everything. But yeah, those are some quick tips and resources. And you could look up feline hyperesthesia syndrome through Cornell. And I would make a point to find organizations, if you're Googling it, that are at least veterinarian related and not necessarily, I love a blogger, but it's probably best to avoid those and focus on like Cornell or Cat Vets or a veterinarian run organization and go there first, because you're going to find the most reliable resources to start.
You said something, Tabitha, that I think is a reoccurring theme that we all touched on today, is that stress reduction is absolutely everything for cats. So, I cannot believe that it has been 2 hours already, but that is all the time we have for today, folks. Thank you to everyone for being here. If we did not get to your question, please go over to Maddie's Pet Forum and we'll have answers posted within a few days. If you missed any of the sessions during the live event, visit Maddie's University to watch them. A link to all the recordings is in the chat for you. Thank you again to our team today. Julie, Marnie, Tabitha, and Charlotte, everyone at Maddie's Fund, big thanks. And to all of our attendees, we hope you feel ready for kitten season and that what you learned makes it your most successful season to date. Thank you all.